According to the American Academy of Physician Assistants, PAs are medical professionals who diagnose illness, develop and manage treatment plans, prescribe medication, and often serve as a patient's principal healthcare provider. PAs practice in every state and in every medical setting and specialty, improving healthcare access and quality.
Our history began in the 1650s when the Russian ruler Peter the Great introduced feldshers, or quickly trained military providers, into the Russian army. The idea of the feldsher initially came from the Germans, but the concept of it became increasingly popular throughout the world during the 1700s and 1800s. Specifically, in the U.S., Congress passed a bill in 1798 allowing the Navy to train hospital maids to assist with care, and in 1898 the U.S. Navy Hospital Corps was established. Eventually, this idea gained popularity outside of the military. In 1940, Dr. Amos Johnson trained a civilian, Buddy Treadwell, to be his assistant. In 1960, a major political act, the AMA advocated for mid-level providers, like Buddy Treadwell, to help expand medical services. At this time, there was a shortage of generalist providers, and the recent creation of Medicare and Medicaid had further increased the gap between the number of patients and providers. In 1965, in order to help combat this shortage, Dr. Steed created the first physician assistant program at Duke University. The first students were male, ex-Navy corpsmen. They were trained as generalists to help in areas of shortage, which were primarily rural. Throughout the 1970s and 80s, physician assistant programs gained accreditation, recognition, and funding. We currently have 236 accredited programs and over 100,000 practicing PAs. Programs are intensely regulated. PA students earn a master's degree and over 2,000 hours of clinical experience. Interestingly, our demographic today has shifted quite a bit from the original male ex-corpsman trained as a generalist. Today, we are a predominantly female profession that works in specialized areas in an urban setting.
One workforce issue currently surrounding PAs is the debate regarding whether we should pursue a doctorate-level degree rather than the current standard of a master's degree. Many healthcare professions have recently started moving towards a doctoral degree, and the PA profession is debating whether they should follow suit. A doctoral degree would acknowledge the difficulty of our training and showcase our capabilities as healthcare providers. It could help PAs stay competitive with NPs and other healthcare professionals, as well as increase support for lobbying efforts. On the other hand, it could create patient confusion regarding our title and may possibly misconvey our scope of practice. The increased length of training and resulting costs could limit the potential pool of applicants, as well as eliminate the advantages of a short and efficient PA program. Physician groups may also read this move as a step towards independent practice. Overall, a higher degree of education is unlikely to change the fundamental role of the practicing PA.